Hello everyone, and welcome back to our health channel. Today, we're going to talk about a common but often misunderstood illness, Hepatitis A. Have you ever wondered what it is, how you get it, and what to do if you're affected? Well, you're in the right place. We're going to break it all down in a simple, easy to understand way. So, grab a cup of tea, get comfortable, and let's dive into the world of Hepatitis A. First things first. What exactly is Hepatitis A? In simple terms, it's a contagious liver infection caused by the Hepatitis A virus, or HAV for short. Now, when people hear hepatitis, they often get worried, thinking about long-term liver problems. Here's some good news. Unlike its cousins, Hepatitis B and C, Hepatitis A does not cause a chronic or lifelong infection. For the vast majority of people, it's a short-term illness, and they recover completely without any lasting damage to their liver. However, the symptoms can be quite unpleasant, making you feel pretty miserable for a while. So, how does this virus get around? It's a bit of an unappetizing topic, but it's crucial to understand. Hepatitis A spreads mainly through what's called the fecal-oral route. This means the virus passes from the stool of an infected person and enters another person's mouth. This can happen in a few common ways. The most frequent is by eating food or drinking water that has been contaminated with the virus. This often happens when someone who has the virus prepares food for others without washing their hands properly after using the toilet. Poor hygiene is a major factor. Another way is by eating raw or undercooked shellfish, like oysters or clams, that have come from water contaminated with sewage. And, of course, close personal contact with someone who is infected, like living in the same household or caring for them, can also lead to transmission. It's all about hygiene. And we'll talk more about how to protect yourself later on. Now, let's talk about symptoms. If you get infected, you won't feel sick right away. The symptoms usually start to appear about 2 to 6 weeks after the virus enters your body. What should you look out for? It often starts with general feelings of being unwell, like fatigue and weakness. You might run a fever, feel nausea, and even start vomiting. Many people experience abdominal pain, especially on the upper right side, which is where your liver is located. You might also lose your appetite completely. One of the most telltale signs of any hepatitis is jaundice. This is when your skin and the whites of your eyes turn a yellowish color. Along with this, you might notice that your urine has become very dark, almost like cola, while your stools have become pale or clay. It's important to know that not everyone shows all these symptoms. In fact, young children often get infected without showing any signs at all, but they can still pass the virus on to others. So, if you get hepatitis A, what's the treatment? This might surprise you, but there's no specific antiviral medicine to kill the hepatitis A virus. Your body's own immune system is the hero here. It's perfectly capable of fighting off the virus and clearing it on its own. Treatment, therefore, is all about supportive care to help your body do its job and to keep you comfortable while you recover. The key word here is rest. Your body needs energy to fight the infection, so taking it easy is non-negotiable. Staying hydrated is also incredibly important. Drink plenty of fluids like water, juice, or broth, especially if you have a fever or are vomiting. As for your diet, try to eat nutritious foods. If you're very nauseous, fatty or greasy foods can make you feel worse, so it's best to stick to simpler, lighter meals. You can take over-the-counter medicines for nausea, fever, or pain, but be very careful. Your liver is already under stress, so you must avoid overdosing on medications like paracetamol. And a very important point: absolutely no alcohol. Alcohol is processed by the liver, and drinking it while you have hepatitis is like pouring gasoline on a fire. You should avoid it completely until your doctor gives you the all clear. Now, for the best part: prevention. The good news is that hepatitis A is highly preventable. The single most effective tool we have is the hepatitis A vaccine. It's safe, effective, and provides long-lasting protection. It's recommended for travelers to certain countries, for people with other liver diseases, and in many places, it's part of the routine childhood vaccination schedule. If you think you might be at risk, talk to your doctor about getting vaccinated. Beyond vaccination, prevention comes down to good old-fashioned hygiene. The golden rule is to wash your hands thoroughly with soap and water after using the bathroom, after changing a diaper, and before preparing or eating food. This simple act can stop the virus in its tracks. When you're traveling, especially in areas where sanitation might be poor, be cautious about what you eat and drink. Stick to bottled, boiled, or properly filtered water. Avoid ice cubes in your drinks, unless you're sure they're made from clean water. And be very wary of raw or undercooked food, particularly salads and seafood. Peel your own fruit and stick to food that is served piping hot. So, what can you expect if you do get sick? What's the long-term outlook? As we mentioned earlier, the prognosis for hepatitis A is generally excellent. Most people recover completely within a few weeks to a couple of months, with no long-term consequences. And once you've had hepatitis A, you develop lifelong immunity, which means you can't get it again. However, it's important to be aware that in very rare cases, things can become more serious. A small percentage of people, particularly older adults, or those who already have a pre-existing liver condition like hepatitis B or C, can develop a severe complication called acute liver failure. This is a medical emergency that requires hospitalization. But again, this is very, very rare. For the overwhelming majority of healthy individuals, hepatitis A is a temporary illness that they will fully recover from. So, to recap, hepatitis A is a viral liver infection that's usually short-term. It spreads through contaminated food, water, and poor hygiene. Symptoms include fatigue, nausea, and jaundice. There's no specific cure, but supportive care, like rest and hydration, helps your body fight it off. And most importantly, it's preventable through vaccination and good hand washing. If you ever suspect you have symptoms of hepatitis, it's crucial to see a doctor. They can do a simple blood test to confirm the diagnosis and give you personalized advice on how to manage your symptoms and protect those around you. Remember, knowledge is power when it comes to your health. Thank you so much for joining me today to learn about hepatitis A. I hope this video has been helpful and has cleared up any questions you might have had. If you found this information valuable, please give this video a thumbs up and consider subscribing to our channel for more health content. Don't forget to hit that notification bell so you won't miss our future videos. Stay safe, stay healthy, and see you in the next one.